Soft ambient clinic sounds. Light footsteps. Low conversations. In an orthopedic clinic, pain is not always loud. Sometimes it begins as a slight discomfort in the knee. Sometimes a stiffness in the shoulder that does not go away easily. Sometimes a dull backache that slowly affects everyday movement. At first, many people ignore these signals. They assume it is temporary. They continue their routine. They adjust their movements. They wait for it to improve. But the human body rarely speaks without a reason. Patients arrive at the clinic with different concerns. Some are worried about a recent strain. Some are confused about ongoing pain. Some are simply looking for relief. In such situations, an orthopedic doctor plays a vital role. They observe how the patient walks. They examine joint movement carefully. They check flexibility and strength. They identify the exact source of discomfort. And most importantly, they explain the condition in a clear and simple way. Because in medical care, communication is as important as treatment. Clear explanations create understanding. Simple instructions reduce mistakes, and calm reassurance builds trust. A patient who understands the problem feels more confident. A patient who feels heard becomes more cooperative. And this connection improves the entire treatment process. Today's episode takes you inside a routine consultation in an orthopedic OPD. You will observe how a doctor interacts with a patient, asks relevant questions, and explains the condition in a clear and professional manner.
I've been having this knee pain for a few days. It becomes worse when I walk or climb stairs. That must be uncomfortable. Don't worry, Emma. The doctor will examine your knee properly and guide you step by step.
The consultation continues. Notice how communication flows between the doctor and the patient. Observe how simple language makes complex situations easier to understand. This episode is part of our playlists, Real Life English and Medical English Conversations. To help you practice regularly, we also post 2 MCQs daily in the community section. These questions will help you test your understanding and strengthen your vocabulary. At Fluent Ears, we follow a simple and effective fluency method. First, listen carefully to the conversation and focus on how each sentence is spoken. Second, repeat the sentences aloud to improve your pronunciation and confidence. Third, try to use similar sentences in your daily life. Fluency develops through consistent practice, not memorization. If you would like to support the channel, you can use the PayPal link given in the description or the Super Thanks feature. Your support helps us continue creating practical and high-quality learning content. Now, let's step into the orthopedic clinic and observe today's consultation. Episode 22. A Doctor-Patient Conversation. General Orthopedic OPD. Emma and Rianne walk into the orthopedic clinic. The space is quiet, clean, organized. A few patients sit in the waiting area speaking softly. The faint sound of pages turning and distant footsteps creates a calm atmosphere. Emma moves carefully, slightly favoring her right leg. Rianne notices, but says nothing. They approach the consultation desk. Dr. Miller looks up from his notes, his expression composed and attentive.
Please come in.
They step inside his cabin. The room feels professional, yet welcoming. Medical charts are placed neatly on the wall.
Have a seat.
Emma sits slowly, adjusting her knee. Rianne sits beside her, watching her with concern. There is a brief pause. The doctor observes quietly, already noting her movement.
What brings you here today?
Emma exhales softly before speaking.
I've been having pain in my knee for the past few days.
Dr. Miller nods slightly, giving her time to continue.
It started suddenly, and I thought it would go away, but it didn't.
The doctor leans forward just a little, focused.
Since when exactly did it start?
Around 3 or 4 days ago?
Rianne adds gently.
It's been getting worse, especially when she moves around.
Dr. Miller shifts his attention back to Emma.
Is it in one knee or both?
Mostly in my right knee.
A short silence follows as the doctor processes the information. Emma adjusts her leg again, slightly uncomfortable.
Does it hurt while walking?
Yes, especially after walking for some time or climbing stairs.
Dr. Miller makes a brief note. His tone remains calm and reassuring.
All right, we'll take this step by step.
Rianne glances at Emma with a small nod. The consultation begins to unfold. Dr. Miller maintains steady eye contact, giving Emma the space to explain her discomfort without interruption. Emma adjusts her sitting position again, trying to ease the pressure on her knee.
Can you describe the pain?
Emma thinks for a moment before answering.
It's mostly a dull pain, but sometimes it suddenly becomes sharp.
Dr. Miller listens carefully, his expression focused.
At first, it didn't feel serious. I thought it would go away on its own.
Rianne looks at her and gently adds,
She kept ignoring it in the beginning.
Emma nods slightly.
Yes, I didn't think it would get worse.
Dr. Miller leans back slightly, observing both of them.
Is it constant, or does it come and go?
It comes and goes, but now it's happening more frequently.
There is a brief pause. Emma looks down at her knee.
Yesterday, after climbing stairs, it suddenly became worse.
Rianne exhales.
That was the last straw. We decided not to delay anymore.
Dr. Miller acknowledges with a calm nod.
On a scale of 1 to 10, how severe is the pain?
Emma thinks carefully.
Around 6 most of the time. Sometimes it reaches 7.
The doctor notes it down quickly. He looks back up, maintaining a composed tone.
Does the pain increase during specific activities?
Yes, walking, climbing stairs, and even standing for too long.
Rianne adds quietly.
She avoids putting too much pressure on it now.
Dr. Miller observes Emma's posture again.
Do you notice any swelling around the knee?
Emma gently touches her knee.
Slight swelling, and it feels tight sometimes.
Dr. Miller nods, connecting the symptoms.
Does the pain reduce when you take rest?
Emma exhales slowly.
Yes, rest helps, but the pain comes back again.
Dr. Miller closes his notebook softly.
All right, that gives me a clearer understanding.
Emma looks a bit relieved. The consultation now begins to move into deeper evaluation. Dr. Miller slightly adjusts his chair, preparing to explore the issue more deeply. His tone remains calm, but more analytical now. Emma sits upright, attentive. Rianne watches quietly.
Did you have any recent injury?
Emma shakes her head gently.
No, nothing serious. I don't remember any fall or accident.
Dr. Miller studies her response carefully.
Any sudden twist or unusual movement?
Emma pauses, thinking.
Not really. Just my regular routine.
Rianne adds thoughtfully.
She does climb stairs frequently at home.
Dr. Miller nods slightly, connecting the detail. There's a brief silence as he processes the information. Emma looks a little concerned now.
Could it be something serious?
Dr. Miller maintains a composed expression.
Do you feel stiffness in the morning?
Emma responds immediately.
Yes, especially when I wake up. It feels tight for some time.
Dr. Miller makes a short note. He then looks back at her knee, observing carefully.
Does the pain reduce after some movement?
Emma nods.
Yes, after walking a little, it becomes slightly better.
Rianne leans forward.
But after some time, it starts hurting again.
Dr. Miller acknowledges with a small nod. The pattern is becoming clearer. He pauses for a moment, then continues.
Does it affect your daily activities?
Emma exhales softly.
Yes, I've started avoiding stairs. Even walking feels uncomfortable now.
Her voice reflects mild frustration.
It's slowly affecting my routine.
Dr. Miller observes her tone, understanding the impact. He leans slightly forward, reassuring but focused.
Are you able to bear full weight on that leg?
Emma hesitates before answering.
Not completely. I try to avoid putting too much pressure.
Rianne nods in agreement. A brief silence follows. Dr. Miller closes his pen and looks at both of them. His expression shows clarity now.
All right. This helps me understand the pattern of your pain.
Emma looks at him, waiting for the next step. The consultation is now moving toward deeper evaluation. Dr. Miller sits back slightly, shifting from immediate symptoms to a broader understanding of Emma's health and routine. Emma looks attentive. Rianne remains quietly supportive.
Have you had similar pain before?
Emma shakes her head.
No, not like this. This feels different.
Dr. Miller observes her response carefully.
Any previous treatment for joint-related issues?
No, I've never needed treatment before.
Rianne adds,
She's generally been fine. No major problems earlier.
Dr. Miller nods, noting the information. A brief pause follows. He glances at Emma's posture again.
Are you taking any medication right now?
No, nothing at the moment.
The doctor makes a quick note. He then shifts slightly forward, focusing on lifestyle.
Do you exercise regularly?
Emma hesitates.
Not really. I don't have a fixed routine.
Rianne smiles lightly.
She spends most of her time sitting, especially during work.
Dr. Miller acknowledges this with a thoughtful nod.
What kind of work do you do?
I mostly sit for long hours. Desk work.
Dr. Miller leans back slightly, connecting the details. There is a moment of silence. Then he speaks in a calm, explanatory tone.
Sometimes, when the body lacks movement, small issues begin to develop. Emma listens carefully. This kind of pain can be an aberration, meaning a deviation from normal joint function.
Emma nods slowly, trying to understand.
So it's not normal?
Dr. Miller gives a balanced response.
Not exactly normal, but not uncommon either.
He pauses briefly, maintaining clarity.
Does your work involve long sitting without breaks?
Emma nods.
Yes. I often sit for hours without moving much.
Rianne looks at her knowingly. Dr. Miller closes his notebook gently. His expression shows that the picture is becoming clearer.
All right. This gives me a better overall understanding.
Emma looks slightly reassured. The consultation now moves toward physical examination. Dr. Miller stands up from his chair and gestures toward the examination area. Emma looks slightly nervous, but cooperative. Rianne watches closely.
Please stand up.
Emma slowly gets up, careful with her movement. She avoids putting too much pressure on her right leg. Dr. Miller observes her posture, her balance, and the way she shifts her weight. There is a brief silence as he studies her movement.
Try to walk a few steps.
Emma begins to walk slowly. Her steps are cautious. There is a slight hesitation when she puts weight on her right knee. Rianne watches with concern. Dr. Miller notices the imbalance immediately. He steps a little closer, maintaining a professional distance.
Now bend your knee gently.
Emma attempts to bend her knee. As she does, her expression changes slightly.
Yes, it hurts here.
She points to the front side of her knee. Dr. Miller nods and moves closer for a better look. He carefully places his hand near the joint area.
Let me examine the joint.
Emma stays still. The room becomes quiet. Dr. Miller checks the movement, applying slight pressure to assess the response.
Relax your leg.
Emma tries to relax, though a bit tense. Rianne softly says,
Just relax. It'll be fine.
Dr. Miller continues the examination with calm precision. He checks flexibility, rotation, response to pressure. A few seconds pass, then he gently steps back.
Don't put too much pressure on it.
Emma slowly straightens her leg and returns to a comfortable position. Dr. Miller folds his arms briefly, thinking.
I can see mild stiffness and some strain in the joint.
Emma listens carefully. Dr. Miller adds in a slightly lighter tone,
You seem to have a good knack for tolerating pain.
Emma gives a small, tired smile.
I guess I just kept ignoring it.
Rianne shakes his head slightly.
That's true. She doesn't complain much.
Dr. Miller nods, but his tone remains firm.
Ignoring pain is not a good habit. The body gives signals for a reason.
Emma looks thoughtful now. The examination has given clarity. Dr. Miller returns to his seat, preparing to explain the condition. Emma and Rianne sit attentively. The examination is complete. Now they wait for clarity. Dr. Miller opens his notebook and glances at his observations. There is a brief pause.
It appears to be a mild strain.
Emma listens closely.
So it's not serious?
Dr. Miller maintains a balanced tone.
Nothing very serious at this stage.
Rianne, relieved. The doctor leans forward a little, ensuring they understand clearly.
But we need to manage it properly.
Emma nods.
Will it take long to recover?
Dr. Miller thinks for a moment before answering.
It depends on how well you follow the treatment.
There is a short silence. Emma looks at her knee again.
I was worried it might get worse.
Dr. Miller responds calmly.
If ignored, the condition may wane slowly, but it can still affect your daily movement.
Emma listens carefully, processing the explanation. Rianne leans forward slightly.
So it's better to treat it now?
Dr. Miller nods with clarity.
We need to address it early to avoid complications.
Emma's expression softens. She looks more reassured now. Dr. Miller continues in a calm tone.
The good thing is, you came at the right time.
Emma gives a small nod.
That's a relief.
The tension in the room reduces. Dr. Miller closes his notebook gently. He is now ready to guide them toward the treatment plan. Dr. Miller sits upright, ready to explain the next steps clearly. Emma and Rianne listen with full attention. There is a brief pause before he begins.
You need to take proper rest for a few days.
Emma nods slowly.
Should I avoid walking completely?
Dr. Miller responds calmly.
Avoid excessive walking and strain on the knee.
Rianne looks at Emma as if reminding her to follow it seriously. Dr. Miller continues, keeping his tone simple and practical.
I will prescribe mild medication for the pain.
Emma listens carefully.
Apply ice to the affected area twice a day.
Emma nods again, absorbing each instruction.
All right.
Dr. Miller leans slightly forward.
Start light exercises after a few days, not immediately.
Rianne asks, can she continue her daily routine? Dr. Miller answers with clarity.
Yes, but don't veer off course from proper care.
Emma gives a small smile at the phrase. Dr. Miller adds, with a slightly serious tone,
Many people delay treatment and later have to bite the bullet.
Emma exhales, understanding the message.
I'm glad we came early.
Dr. Miller nods reassuringly.
Come for a follow-up after 1 week.
There is a sense of closure in his tone. Emma looks more relaxed now.
Thank you, doctor. I feel much better after talking to you.
Rianne smiles.
Yes, this really helped.
Dr. Miller gives a professional nod.
Take care and follow the instructions properly.
Emma stands up carefully this time, more aware of her movement. The tension from the beginning is gone. The consultation ends on a calm and confident note. Let's take a moment to reflect on today's consultation. You observed how a doctor communicates clearly, asks the right questions, and explains a condition in a simple and professional way. From the moment Emma entered the clinic to the final advice, every step showed how effective communication builds trust and clarity.
I feel much better now. Not just physically, but mentally too.
Yes, and we learned a lot along the way. Like when things become the last straw, or when you just have to bite the bullet and not veer off course from proper care.
Emma smiles slightly.
And those words too. Knack, aberration, wane. They actually made more sense in the conversation.
Exactly. It didn't feel like studying. It felt real.
That is the idea. Learning happens best when language is used in real situations. In this episode, you listened to how a doctor guided a patient step by step using simple, clear, and practical language. Now it's your turn. Listen again. Repeat the sentences and try to use similar expressions in your daily life. Fluency is not built by memorizing. It is built by practicing. Let's take a moment to reflect on today's consultation. You observed how a doctor communicates clearly, asks the right questions, and explains a condition in a simple and professional way.
I feel much better now. Not just physically, but mentally too.
Yes, and we learned a lot. Like when things become the last straw, when you have to bite the bullet, and how important it is not to veer off course from proper care.
And those words too. Knack, aberration, wane. They felt natural in the conversation.
Exactly. It didn't feel like learning. It felt real.
That is the idea. At Fluent Ears, we focus on learning through real-life situations. This episode is part of our real-life English and medical English conversations playlists, designed to help you build fluency step by step. To support your learning, we also post 2 MCQs daily in the community section. Make sure you check them regularly and test your understanding. Now, follow the Fluent Ears method. Listen carefully. Repeat confidently. Use these sentences in your daily life. Fluency is built through practice, not memorization. If you'd like to support the channel, you can use the PayPal link in the description or the Super Thanks feature. And don't forget to follow the channel for more real-life English conversations.